Thank you for tuning in to Amaris B podcast. I am Dr. Ivan Puah, and I founded Amaris B Clinic in 2004. I am an MOH accredited liposuction doctor and medical aesthetics doctor based in Singapore. I have been trained directly under Dr. Alfredo Hoyos and Dr. John Millard for basal liposuction, Dr. Pierre Fournier for liposculpture, fat grafting, and thread lift. Also by Dr. Delgado for dedicated surgical training in gynecomastia surgery in San Francisco.
Today, we're going to talk about collagen, one of the most important component in our skin and soft tissue. Collagen is a structural protein that forms the connective tissue throughout our body, from skin, bones, connective tissue, tendons, ligaments, so on and so forth. So when we age, the amount and the quality of the collagen changes. The collagen density of our skin and soft tissue reduces when we age. It becomes less elastic and more fragile as well. Collagen is a natural protein that keeps the skin firm, toned, and youthful. Our skin loses its strength to aging and gravity. There are changes to the skin, to the collagen as we age. The amount, the density of the collagen reduces as we age. So it affects directly and indirectly the skin, our soft tissue, the bones, muscles, so on and so forth. So as we age, as our collagen depleted, there will be changes to our appearance. Deep skin aging happens when the body produces less and less collagen in later years. This will lead to the skin becomes thinner as the oil and hyaluronic acid in the body decreases and will lead to wrinkles and saggy skin. Collagen is the component that holds the fort of the skin and soft tissue. So when it loses its density and its elasticity, as we age, we lose the ability to renew and repair most of our tissue, and collagen is just one of those tissues that our body loses its ability to renew itself. So it becomes inefficient. So as the time passes, more and more degenerative changes will cause and will lead to less quality and less density of collagen and connective tissues. Unfortunately, our body and our skin, they do not repair itself. It will just age. Any degenerative or aging changes will just make it worse as time passes. The only way that your skin will renew itself is to be triggered by external factors such as medical treatments, irritations, injury, mechanical stimulation, and so on and so forth. So something needs to be applied or done or happen to the skin to trigger a renewal process. There are many products such as skincare products or even supplements that claims that when you ingest or you apply onto your body and skin, it will renew, it will lead to a renewal of collagen density and collagen quality. But unfortunately, most of them, if not all of them, do not work because collagen is a big molecule and it's quite impossible for any applicable creams allowing the collagen to bypass the skin barrier, going into the deep tissue, and lead to renewal or stimulation of collagen production. The same goes with the ingestible supplements. Collagen will be broken down into small amino acids before it gets absorbed into your blood system, and it cannot be transported as a whole collagen molecule to the tissue that is intended to renew or target. One of the common myths that you often hear and see is that if you drink or ingest collagen-related soup or supplements, it will lead to replenishment or improvements of your collagen quality or skin quality. But it's not true because, like I mentioned before, that collagen molecules are big. So if you ingest or drink through soup or supplements or food, your liver and your body will just break it down into small molecules such as amino acids where your body will be absorbed and into the system. So collagen itself cannot be directly absorbed into your system. It will only be broken into smaller protein amino acids and allowing your body to rebuild whatever that's required. So drinking collagen soup or ingesting collagen supplements do not necessarily lead to any change in your quality of the skin, the quantity or quality of collagen. We are always exposed to sun and oxidative damages, radiation, and so on and so forth that can affect or damage our skin. And so directly or indirectly affecting the quality of our collagen and connective tissue. So yes, all these external factors may affect the rate of degenerative changes of our collagen and skin. Smoking does lead to more oxidative damages, and of course, certain food and certain kind of exposure to environmental issues such as radiation and on a chemical exposure may lead to damages as well. There are several treatments that can be used to stimulate fibroblastic or even collagen production for the skin. One of them is a non-invasive treatment called our therapy, or what we call micro-focus ultrasound with visualization. It uses a focused ultrasound beam to target skin depth between 1.5 to 4.5 millimeter, generating thermal activity to stimulate fibroblastic or collagen renewal. Our therapy is a non-surgical, non-invasive treatment that allows it to stimulate collagen production and helps to treat saggy skin, jowls, improve skin laxity, turkey neck, droopy eyelids, lines, wrinkles around the neck, all the way to the chest. It is what we use to improve skin quality, improve skin elasticity, and to help to tighten the facial skin and facial contour. So I often kind of describe to patients that you should do our therapy at least once a year to maintain your skin's elasticity, to not allow it to age in a natural manner. One of the examples I always tell patients is that if you do not do any treatment, you will age naturally. So in 10 years' time, you look 10 years older, right? So we don't want that to happen. By using our therapy, we're able to slow it down dramatically, your aging process. So hopefully in 10 years' time, you look maybe 1 or 2 years older and not 10 years older. This is what I always tell patients. It's like we are able to freeze your aging process or slow down your aging process so that you will look like 10 years younger when you are 10 years older. Because 10 years later, when you are 10 years older, it's very difficult to reverse the aging process. You probably need many invasive or even surgical treatment to make you look 10 years younger or several years younger. But by doing our therapy, you will look like you haven't aged or aged in a very slow manner, and that's the most important thing. So this is what we call collagen investment, is to slow your aging down so that you look like you hardly age at all 5 or 10 years later. You look exactly the same as 5 to 10 years ago. Some may think that HIFU is the same as our therapy, but they are not. Unlike HIFU, our therapy has added benefits of real-time imaging and micro-focus ultrasound technology. Additionally, HIFU and ultrasound uses different types of ultrasound beams. Can our therapy be used to lift brows? Yes, it does help to tighten and lift upper eyelids. And in doing so, it will make your upper third of the face look a bit lifted, like sort of a mini facelift. Are there any side effects using our therapy? There are very minimal side effects, such as redness, pain, and discomfort after the treatment, but they are usually temporary and the effect will resolve within a few minutes or a few hours after that. The next treatment that we can use to stimulate skin collagen renewal or production is radiofrequency microneedling. Radiofrequency microneedling is different from conventional needling due to its unique mechanism of action. During the treatment, the skin gets triggered into a complex cascade of microscopic reaction. It initiates healing, remodeling process by stimulating production of collagen and elastin for youthful and radiant skin tone. It helps to improve skin texture, pores, pigmentation, and skin tone. The benefits of radiofrequency microneedling includes non-surgical facelift, improvement of skin texture, skin tightening, reduction of wrinkles and fine lines, improvements on pores, scars, promotion collagen formation, and improvements of stretch marks. Radiofrequency microneedling helps to tighten skin around the eyelids, for postpartum mom aiming to tighten abdominal skin, and for those who are bothered with knee wrinkles. Biostimulator is one of the most popular, most commonly used treatment by clinics, by doctors to stimulate collagen production. Collagen biostimulators are like dermal fillers as they are both injectables. However, collagen biostimulator aims to repair skin from within by stimulating collagen regrowth to counter the effect of aging. Unlike fillers, where it's commonly used to replace volume, biostimulators target deep within skin layers to activate fibroblasts and to regenerate collagen. The effect and results of biostimulators are often more natural, even, and helps to counter the effect of aging. They can smooth wrinkles, fine lines, enhance skin texture, skin resilience, improve skin quality and elasticity. It can even be used to help restore facial volume loss. These benefits are achieved by harnessing the body's natural healing capabilities and stimulating the production of new, healthy collagen. Examples of common collagen biostimulators injectables in Singapore include Radius, Juvilook, Lenisna, Sculpting,
Thank you for
Glory,
listening. I
and
hope you
others.
enjoyed the podcast today. If you do have any questions, please feel free to send it to us. We'll be glad to answer all of them. See you again.